CNA Practice Test Florida Free. Question 1. Which of the following is a sign of dehydration? Clear, pale yellow urine. Moist skin. Dark, concentrated urine. Increased appetite. Dark, strong-smelling urine and low output are classic signs of dehydration. Question 2. If a CNA sees another staff member hitting a resident, what is the first action to take? Call the police immediately. Stop the abuse and ensure the resident is safe. Report it at the end of the shift. Ignore it if it doesn't happen again. Safety is the priority. The CNA must intervene to stop the abuse immediately. Question 3. What is a common sign of a urinary tract infection, UTI, in an elderly resident? Sudden confusion. Increased appetite. Better sleep. Improved mobility. In the elderly, UTI is often present with cognitive changes or delirium rather than just physical symptoms. Question 4. What is the most effective way to prevent the spread of infection? Wearing gloves at all times. Washing hands frequently. Using antibacterial spray on everything. Keeping all residents in their rooms. Hand washing is the single most important practice in preventing the spread of infection. Question 5. Which of the following is an example of objective data? The resident says they have a headache. The resident's blood pressure is 120/80. The resident feels nauseous. The resident is worried about their family. Objective data is observable and measurable information, such as vital signs. Question 6. Which of the following is a normal part of aging? Loss of all memory. Slowed reflexes and reaction time. Incontinence. Constant pain. While some decline is normal, like slower reflexes, things like total memory loss or incontinence are not normal parts of aging. Question 7. When communicating with a hearing-impaired resident, the CNA should shout as loudly as possible, speak slowly and face the resident directly, only use written notes, avoid talking to them. Facing the resident allows them to see your lips and facial expressions, and speaking clearly helps communication. Question 8. How often should a resident who is unable to move be repositioned? Every hour. Every 2 hours. Once per shift. Only when they complain of pain. To prevent pressure ulcers, immobile residents should be repositioned at least every 2 hours. Question 9. A resident refuses a bath. What should the CNA do? Force the resident to bathe. Skip the bath and try again later. Tell the resident's family. Document that the resident is difficult. Residents have the right to refuse care. The CNA should respect the refusal and try again at a different time. Question 10. A resident's tray has a full glass of water, but the resident is on NPO status. What does this mean? Nothing by mouth. Next patient only. Needs physical observation. Nutrition per oral. NPO stands for nil per os, meaning nothing by mouth. No food or water should be given. Question 11. A resident is choking and cannot speak or breathe. What should the CNA do? Perform the Heimlich maneuver, abdominal thrusts. Offer the resident a glass of water. Wait for the nurse to arrive. Hit the resident on the back. Abdominal thrusts are the standard emergency procedure for a conscious person with a complete airway obstruction. Question 12. What is sundowning? Increased confusion and agitation in the evening hours. Sleeping all day and staying up all night. A skin condition caused by the sun. The resident feeling better at the end of the day. Sundowning is a phenomenon where confusion and behavioral problems worsen as daylight fades. Question 13. When a resident is on a bladder training program, the CNA should restrict the resident's fluid intake. Take the resident to the bathroom on a scheduled basis. Tell the resident to hold it as long as possible. Always keep a catheter in place. Scheduled toileting helps the resident regain control and awareness of bladder function. Question 14. A resident is having a seizure. What is the CNA's priority? Place a spoon in the resident's mouth. Hold the resident down to stop the shaking. Protect the resident from injury and clear the area. Run out of the room to find help. Safety is key. Protect the head and clear objects away. Never put anything in their mouth or restrain them. Question 15. An ombudsman is someone who provides medical care to residents, advocates for the rights of residents in long-term care, manages the facility's budget, inspects the kitchen for safety. An ombudsman is an official advocate who helps resolve complaints and protect resident rights. Question 16. What is the proper method for cleaning the perineal area of a female resident? From back to front, from front to back, in a circular motion, with a scrub brush. Cleaning from front to back, cleanest to dirtiest, prevents the spread of bacteria from the anal area to the urethra. Question 17. Which document describes the tasks a CNA is legally allowed to perform? The resident's care plan, the CNA's job application, the state's scope of practice, the facility's menu. The scope of practice defines the legal limits and responsibilities of the CNA role in that state. Question 18. What is the correct way to lift a heavy object? Bend at the waist and keep legs straight. Keep feet close together. Bend at the knees and use leg muscles. Lift with your back muscles. Proper body mechanics involve using the strong leg muscles and keeping the back straight to prevent injury. Question 19. A resident is nearing the end of life. What is the CNA's primary role? To encourage the resident to eat a large meal, to provide comfort and emotional support, to discuss medical treatments with the family, to ignore the resident since they are dying. Palliative care focuses on comfort, dignity, and support for both the resident and their family. Question 20. When dressing a resident with a weak right arm, which arm should be dressed first? The left arm, the right arm, both arms at the same time. It doesn't matter. When dressing, always start with the weak or affected side first. Dress affected/weak.